Let's talk about the apparatus. You have rings. There are different types of rings. 5/8 ring, full ring, half ring, omega ring. Omega ring is something that you use in the shoulder. 5/8 ring you use to the proximal tibia. It's available in different sizes. One of the things that you should know, the thickness of the ring is 5 millimeter and the width is 14 millimeter. And each hole is about 8 millimeter. And the threaded rods that you use is about 6 millimeter. So there is about 2 millimeter gap when you put the threaded rod into the hole. It's available in different materials that you know. Whenever you are fixing these half rings, you have to fix like this. Then only the rings will be parallel to each other. So not like this. Then the rings are in different planes, which will create trouble during the surgery. And remember, when you are fixing these rings, half rings, you are actually losing 3 holes here. So one hole to the connector and another hole on either side of this bolt. So when you are counting the number of holes, you have to actually count one hole in between this connector and this hole. That is one hole here. So number of configurations are possible with this half rings. I think Sir is joining now. Hello, Sir. Can you hear me?
Yeah. Go ahead. Yeah.
Yeah,
Sorry,
I just started.
Okay. Right. Okay.
Oh,
Continue.
yeah. I'm just describing the apparatus, sir, about the rings and its diameters, thickness, and everything, and how to assemble it.
Yeah.
And
Right.
the correct way to assemble. And this is not the correct way to assemble because the rings are not parallel.
Okay. Right.
And when we assemble it, the half rings, we will lose 3 holes. That we have to keep in mind here. So the half rings can be assembled in different configurations like this. You can assemble 2 half rings to create 5/8 ring even. And you can use the half strings and the straight plates and half ring to create the foot plate as well. So different configurations are possible. And these arches are actually an invention of Italian surgeons. So that's why we call it Italian arch. It is in 2 different varieties, 90 degree and 120 degrees. And that allows half pins to be assembled in different directions to the proximal pin. And this is one of the basic thing, that is bolt, which has a pitch of 1 millimeter and a diameter of 6 millimeter. And the hexagonal head is 10 millimeter, which fits into the 10 millimeter spanner. This is another basic unit, nut, which has the same 6 millimeter diameter, thread diameter, and a pitch of 1 millimeter. So one full turn will advance it 1 millimeter. And you have scare nut for the distraction for the patients to be able to understand easily. They have made a scare nut as well. And there is a nylon nut, which has a nylon part within the nut. I will tell you the use of this nylon nut in a while. So we have different thickness, 3 millimeter, 5 millimeter, 6 millimeter nuts are there. So 3 millimeter nuts, we use it to as a stopper to one another. When you create a hinge like this, you cannot completely tighten the nut, then the hinge will not work. because there is so much of friction. So you might want to keep the nut 1 millimeter away from the hinge. And if you keep only one nut, with the vibrations, the nut will just turn and it will come out after some time. And that widens the space also. So the hinge will not be stable. So you need to use two nuts and tighten two nuts together while leaving the space to the hinge to work. So that's how you create a hinge. This is a common mistake I also didn't know until I read this one. And the nylon nut is a nut which is a lock nut. We actually have these nuts in the OTO. I also did not know the use for a long time. This nylon nut, whenever you screw it, it's very stiff and it will not back for the vibration. It will not just back roll for the vibration. It's a very stiff one because the nylon gets into the threads and keeps it in place. Rods are the basic connecting unit. Pitch of the rod is again 1 millimeter. Diameter is 6 millimeter. So the thread hole is, the smooth hole of the plate is 8 millimeter. These thread rods are there. This is threaded rod. This is cannulated rod and this is slotted rod. There are different uses. As you can see, if you can use the slotted rod to catch the wire into that. And you can use the cannulated rod also to catch the wire into that. The difference is in the slotted rod, the wire will be in the center. And here in the cannulated rod, the wire will be in the periphery. So you can use it to pull things. You can use the olive wire on the other side and pull the bone fragment towards this rod like that. And this is telescopic rod, which can be adjusted. Telescopic rods are a bit stronger than the normal threaded rod. And this is graduated telescopic rod, which is an invention of Italian surgeon. It has a ratchet so that you can press it and turn. And you can even see how much of lengthening and shortening you are achieving with this. So this is the most reliable method of achieving distraction or compression. And you have a lot of connection plates, short connection plates, long connection plates. So I will show one by one. These are called short connection plates. And they have one gap here that is equivalent to a hole there. So there are different ones. So this hole which is apart is to attach the plate to the ring. You have long connection plates which can really reinforce the construct when you join it to the proximal ring and the distal ring. You have twisted plates that creates 90-degree planes for you to play with. And you have connection plates with the threaded end, So that has various uses. You have curved plate, which can be used as an extension to the half ring so that it becomes 5/8 ring. So you can actually catch the larger diameter ring to the smaller diameter ring with these plates. So that is one of the use here. But it is not recommended. You better use the same diameter rings so that it is more stable. And you can make a omega ring to the shoulder. So a lot of uses there. So these are different configuration. You can use the plates even to create hinge. Wires. These are just K wires. We use 1.5 for the pediatric population, 1.8 or 2 millimeter for the adult population. There are different types. So this, the type A and the C are the trocar tip one. That is for the cancellous bone. So you use it in the metaphyseal area. And this D and B are the bayonet tip. That is for the cortical bone. So if you drill the trocar tip to the cortical bone, it's very difficult. You have to drill for a long time and that generates a lot of thermal energy and that will cause bone necrosis and pin loosening. So this is the olive wire. which is actually made out of a larger diameter cylindrical wire. It is milled from that. That's why it's expensive. So if you don't have olive wires, you can simply bend the wire and make it as a stoppers. That is also possible, but it's not that stable as olive wires. The rule is you catch the wire wherever it is. Do not drag the wire to where you want. That is one of the rules in Ilizarov surgery. So here you can see the wire comes at the center of the hole, which needs cannulated wire fixation bolt. And here the wire is in the eccentrical place, so that needs slotted wire fixation bolt. And if the wire is in between the holes, you can use wire fixation clamp or wire fixation buckle, which does not need the hole. I will talk about it in a while. And when you are talking, when you think about tensioning, you can use this preliminary tensioning method that is called the Russian method of tensioning, where you rotate the bolt and the nut simultaneously for about 45 degree. So that creates tension. So this is how Ilizarov started his tensioning, because he did not have tensioner initially. But at the same time, what happens if you do that rotation? If look at the picture down B, if you rotate only one nut, the bone translates, and if you rotate both nuts, the bone rotates. So that is the problem by rotating the nut. But if you have the wire coming in between the holes like this, you can catch the wire and rotate the nut and make this point in between the holes, so that it will not cause any displacement at the end of your procedure. So if you don't have wire fixation buckle or wire fixation clamp, you can use this technique. Otherwise, it is not recommended. So it's always better to use the dynamometer, which measures the tension. You can use it like this. In places where you cannot keep the dynamometer, you can put 2 or 1 threaded sockets and tension it. This is manual tensioner that you all know. That also can be used. So about the wire fixation bolts, you have 2 varieties, cannulated and the slotted one. And also you have a wire fixation bolt with a threaded hole. This is a different variety of wire fixation bolt, where the head is about 11 millimeter long. So this is very high. So when there is a crowded place, it's very difficult to put the spanner in and work. So this 11 millimeter head protrudes out so that you can work with it. So you can still catch this with a spanner and tighten it. So that is the use of this. And also it has threaded hole on top of it. So you can mount another unit on top of it, and additional things can be done with this. These are the wire fixation clamps. So the buckles that I was talking about, there are 2 varieties. One is solid frame clamp and the other one is open frame clamp. This one is the solid frame and this one is open frame. Solid frame can be slide into the ring. Open frame, you have a short plate underneath, so you can unscrew it, take it off and then put it, and then put the plate in. So depending on the need, you can use either solid clamp or open clamp. So this will clamp the wire without the need of hole. You don't need a hole to fix the wire to the ring. So you can get precise rotation, precise translation anywhere in the wrong in the ring, along the ring, even if you don't have holes in that place. So that's the use of this clamp. So it's very useful to have the clamp in our set. We actually have these clamps, but nobody knew the use, and that is there in the shelves. I checked. Half pins are different varieties, can be continuously threaded or interrupted threaded. 4, 5, 6 millimeter diameters are available. And you need a pin fixation bolt to catch the pins. These are called pins, and the other elements are called wires. Do not confuse the terminology, pins and wires. These are the posts. You have two different varieties. This is the male post, one on top of. This is the female post, the one on the bottom. You can actually create hinges with the post. This one hole post is called half hinges. The reason why they are called half hinges is that when you actually see this, if you join two one hole post or half hinges, the threaded rods will be parallel to each other. The plates of these hinges are made very thin to make the threaded rods to be in line with each other. But when you join the post like this, the threaded rods will be will not be parallel to each other. So that's why whenever you want to use hinges, try to use these half hinges rather than these two hole posts. You can use you can use three one hole posts or half hinges to make two axis hinge, or you can you have specialized two axis hinges which can be used, and that can be used to correct deformities in two planes like equinus and varus. So in that case you might need this. I will talk about this in surgical principles later. This is universal joint. This is called threaded socket. Various uses are there for the threaded socket. You can use as an extension to the rod. You can catch a half pin with this. You can join two rings, or even you can fix a wire with this. These are called bushings. Their inner diameter is bigger than the 6 millimeter. So that means it is around 7 millimeter hole. So the threaded rod will just slide in. It doesn't have thread inside to catch. So there are different uses of it. I don't want to talk about it. I'll just introduce the things about bushings. You all know there are washers. It can be flat, circular, semicircular, or oval. There can be slotted washers. There are conical washers. There are serrated washers. So these are different washers. A washer can be even used as a wire fixation bolt. You can see that you don't need the wire fixation bolt. A slotted washer and another washer underneath, and you tighten two nuts, or even you can put a bolt and a nut, will work as a wire fixation unit. And this conical washer is particularly useful to create an angle between this frame and the rod. So this is the frame and the rod. If you want to create an angle between these, you will have to use a conical wire, and the maximum angle that you can create is 15 degrees. So you can create any angle in between, but the stability of the construct is less. These are called square sockets or Wrenchoqubes. Yeah, and you can use it to catch the pins. You have to use it with appropriate sleeve. These are oblique support connectors you might need in femurs. This is Paley's translation rotation device. I will talk about this, the use of this device, when I talk about the surgical principles later. This is manual tensioner, and this is dynamometric tensioner. These instruments, better to know their names, and that is combination spanner. Spanner is the US terminology. Wrench is American terminology. That's short. This is the short combination spanner. We use 10 millimeter. That's a T spanner or T wrench. And this is open-ended spanner, which is 19 size. And this 19 size is needed for the graduated telescopic rod, because it has the nut of 19. This is open-ended spanner 10-13, and this is tubular spanner. So with these implants, you have infinite possibilities of creating different things. So this picture is actually taken from Ilizarov's original picture. He has created a construct which can translate the bone to any place wherever you want, and you can catch the bone with the ring, uh, with the ring within this box. Okay, so let's talk about biomechanics a little bit. The cantilever mechanism is the mechanism that we usually see in plate fixations and monolateral EF. But as opposed to this is a beam mechanics, where you have something on either side and a wire running in between. So it is 16 times higher than the cantilever mechanics. So that is why it is so stable, even it is a wire. And what happens, these tension wires resist bending, translational and torsional forces, but permits axial elastic micromotion. And this creates an ideal environment for fracture healing. So what is this axial elastic micromotion does? As you can see in this picture, when you have an axial micromotion, they say there is something called piezoelectric phenomena that stimulates the electrical activity. That means the mechanical stress stimulates the electrical activity, and that causes electrical impulses and activates the ion channels, and that increases the mitosis, that in turn increases the cellular differentiation. This is a hypothesis that is given, but nobody exactly knows what is happening there. But they have noted an increased accelerated fracture healing with this elastic micromotion. So what factors govern the stability of this fixator? There are extrinsic factors and there are intrinsic factors. Extrinsic factors can be divided into rigidity of the assembly and connection of the apparatus to the bone. So what governs the rigidity of the assembly? One, material. Stainless steel is more strong than the carbon and aluminum. So carbon rings are made 6 or 7 millimeter. So that is about a little bit thicker than the stainless steel. Diameter. If the ring diameter is less, more stable. Number of ring. At least 2 rings per segment is needed. And the type and number of ring connectors. That is, you use threaded rod, but if you use threaded sockets or plates, that is more stable. And the connection of apparatus to the bone, the way you connect the apparatus to the bone, that also influence. In that, you can divide it into ring factors. That means where you place the ring. Near, far is more stable. And the other thing is construct inclination. I will talk about it in a while. Then the third thing is bone position within the ring. So if you have centrically placed bone, that is a little less stable than eccentric. Eccentric placement is more stable, but this is not in your hand because soft tissues are the main determinant of where you are going to place your bone within the ring. So the ring inclination is like this. Your axis of the bone, if it is parallel to the ring axis, that is more stable construct because axial compression forces, compression distraction forces acting in the along the axis of the bone. But if you place the bone in a inclination, shear forces develops at the fracture site, and that is less stable configuration. So that is called ring inclination. And there are a number of wire factors to consider. Wire diameter, if it is more stable. Wire type, olive wire is more stable than the normal wire. Number of wires, the more the wires, more stable. Wire tension should be appropriately applied, that is more stable. Wire angle, wire position to the ring and ring connectors. I'll talk about these two in the subsequent slides. Again, the number and diameter of the and the crossing angle of the half pins. Okay, so when you have a construct like this, 90-90 wire angle, that is more stable. And when the wire angle reduces, it becomes less stable. But because of the anatomical constraint, it is very difficult to have 90-90 configuration. So we actually select 60 degree. If it is less than 45 degrees, less stable. So let's say, see in this diagram, diagram A is very stable, but diagram B, you have mediolateral instability. Diagram C, wire angle is less, you have mediolateral translation developing. Diagram D, anteromedial translation stability is less. And not only that, when you have less wire angle, you have, now look at the diagram B, anteroposterior translation stability is less. But you can think of another alternative. You put two olive wires on either side, so that translational instability is eliminated. But you have mediolateral bending instability developing because the obtuse, because of the larger angle on the mediolateral side, the ring can mediolaterally unstable. So the solution is to put a drop wire like this, so that you will achieve mediolateral bending stability as well. So if you are using only one ring to a fragment, you have two wires, olive on either side, and a drop wire away from the ring level, which is very stable. Rather, so this is more equivalent to having two rings. Wire position on the ring is important. If you have the wire on the ring wall, which is more stable than having the wire in a post. And when you're having multiple wires, the wires, if the wires are further apart in different planes, that is more stable. If the wire planes are like, you know, further separated, that is more stable than it is in a single plane. And when you have the wires fixed close to the ring connectors, that is the rods, it is more stable than it is fixed further apart. And there are things about intrinsic stability as well. If the surface area of the bone contact at the interrupted site is bigger, then it is more stable. Then the length, diameter, and maturation of the regenerate also important, because if the length of the regenerate is short, large diameter, and mature regenerate, it is more stable. The length of the treated segment, if it is shorter, it is more stable. And the amount and quality of the soft tissues around the bone, that is also contributory, because if the tissues get tensioned, then it is more stable rather than the low quality tensioned tissue. Okay, so and also one last thing about the reusability of the implants. It is heavily used. You screw it, the threaded gets damaged, rods can bend, rings can deform. So most of the authors discourage the reusing of the implants, but in our setup, it is very difficult. Somehow we have to reuse it, otherwise we don't have implants to use in other patients. So that is about the apparatus and the biomechanics. We will have to talk about the surgical principles and techniques in a different setup. So we will have only short.
Okay.
Yes.
Yeah, that's a good presentation. I think it's an eye opener for everyone. I think it's a wonderful. I think time is not enough. Wonderful sort of device that I think, as you said, some of the implants that are not being used, certain things because of lack of knowledge. I think your presentation will be a good eye opener, and I advise all my trainees to sort of master this Ilizarov, which has a specific usefulness in certain practices. You don't have any option unless you master this Ilizarov. So I think gradually we will talk about this. I think you have done so many cases, and you can sort of train other junior trainees for this method. I also have found this a much useful tool than the external fixator, which is much stable, and also it has sort of very good sort of versatility. Only the thing is, it is a bit complex, but as you go along with the practice, I think you can overcome this. I think you need to have a lot of learning curve in this when you master this device. So we will talk more about the clinical cases next time.
Yes, sir.